Hi Jackson, we can do your lower extremity examination. First I'm going to start with just a general observation of your leg, checking for any rashes, hair patterns, discolorations, redness or anything like that, and it looks pretty good. And then just go down and check for temperature using the back of my hand, all the way down, front, back, sides, looking good. Make sure it's all symmetrical. And that's all good. I will then observe trophic changes, looking for bony edema, just any swelling around the ankles, anything like that. That all looks pretty good. And then look for chronic venous just all the way up and down the legs. And obviously you can see it doesn't have any of that. No pigmentations or ulcers. Look for skin color, and it all looks pretty symmetrical. There's a little paler up here in the thighs, so you can work on that. But otherwise, strong. Toenails look good. No, infections or open wounds down on the toes. I would then just do some nail compression tests. Looks good all the way across. Turns good back to the pink color. Then I'm going to palpate the pulses in the lower extremity, starting with the dorsalis pedis pulse. And I would do it bilaterally. And that looks good. I would then do the posterior tibial, right behind the malleolus, and just checking for strength, symmetry, and that looks pretty good. I would then check for the popliteal pulse, and that one's good. And if you find pulses down lower, you don't have to check the popliteal pulse, obviously, because you don't have to check the popliteal because it'll be there. And those still all check out. I would then move on to testing for pitting edema, which I would just press the thumb down here in the lower ankle for 5 seconds, checking just if there's an indent there, or obviously if there is any pitting edema. And that looks all good. I'm going to palpate across the inguinal canal, so if you could grab your testicles, move them to the side please for me. I'm just going to palpate across here. Find the femoral artery, nerve, vein, and lymphatics. And obviously found them all. Checking for the lymphatics, just doing circular motions down and then across. And then I would auscultate the femoral artery. So I'm just going to pretend like I'm going to do that because I don't have my stethoscope. So I would use the bell, and then I would auscultate skin on skin on the femoral artery, checking for breweries, and that all checks out. I would then do a hernia check, which is medial to the femoral vein. If you could turn your head and cough for me, Jackson. Alright, and that's all good, no hernia there. I would then raise, I would do a Holmes sign. I would raise his leg like this if there's any pain, and then I would, if there was no pain, I would then squeeze his calf, and there would be severe pain if there was a clot in the calf. I would then have the patient stand up for me and to do the venous tap test. I would palpate the long saphenous vein, and then I would put pressure on it, and then I would tap below it. And if there was, I could feel the tapping if the vein valves weren't working correctly.